But today we are talking about not vaccines, but we are talking about injectables, right?
Injections, yes. Everybody fears injections, but they're really not so bad. Mm-hmm. So diabetes, there's two major groups of injectables now. It's not just insulin. Insulin, of course, is the one people think of. Type 1 diabetes requires insulin because they don't make insulin.
Right.
So usually the insulin you give is two varieties. One is long-acting, which covers you day and night, even if you don't eat. And then short-acting you give at meals. So the short-acting insulin keeps the sugar from going up as high after eating. So that's called the bolus insulin. And then the long-acting is called the basal insulin. Those are the two combinations you give for type 1. Or you give them a pump, and that has continuous short-acting insulin in it. So you can program it for any basal rate you want. Mm-hmm. If you need more insulin at 3 a.m. in the morning, you don't have to get up and give a shot. You can just program the computer in the pump to give you that insulin.
What does basal mean?
Basal just is...
like a base line?
Yeah, basal is the same amount all the time, continuously. It's not... A bolus, of course, is a big amount at once, and that's what bolus insulin is. Bolus insulin is before meals, or if your sugar's high and you want to give it, it's short-acting or it's quick. Basal takes a long time to work, so it's slowly being released over the whole day.
But the equipment, the needles have changed a lot over the years. I remember just my friend when I was my first understanding of type 1 diabetes, juvenile diabetes at the time. He had this little contraption set up, and to give yourself a shot, and then my wife had gestational diabetes, and so she had one. That's 25 years ago, and things have changed a lot.
Yeah, the needles are smaller and thinner, so you really don't want to use them more than once because they leave little pieces of metal in your skin. So they're very small. You can barely feel it. So it's not like sticking your finger for diabetes when you get a little drop of blood and it hurts real bad. That's not it. The insulin shots, any shot for diabetes now is very, just not painful at all. It's just easy to do it. And people get over that fear, I think, eventually. But almost everybody with diabetes may eventually have to be on some kind of injection, even type 2. So type 1s have to be on injections, multiple injections or insulin pump, every day to do what their pancreas does. So the pancreas normally makes a little bit of insulin all the time, even when you're not eating. So that's the basal insulin. So that keeps the liver from making sugar all night. That sort of calms everything down, keeps the body from making excessive sugar. And then at meals, you need more insulin, especially carbohydrates. So the pancreas does that. And if your pancreas doesn't work, or you're resistant to what the pancreas makes, which is type 2, then you need to mimic the pancreas. And the way to mimic it is to do the basal insulin for the all day, even if you don't eat type insulin, and the bolus at meals. So,
okay.
But type 2s may start out not needing insulin because they're making lots of insulin because they're insulin resistant. They have to make a lot of insulin. But over time, the pancreas wears out, and then you have to add insulin. You may not add all the type of insulin that the type 1 does, but type 2s may need at least basal insulin to get them through the night. Their sugar might be high in the morning, and they have to have a basal insulin at night. So that's what you start with in type 2s. Start with an insulin that covers the highest sugar of the day. Now, sometimes people eat a lot at night, and that's the highest sugar is right before you go to bed. In that case, you may want to just do short-acting at supper or not eat as many carbohydrates.
Right.
So it's always, you can do one or the other. But if your sugar is really high at night, it's going to be high in the morning. So some people blame, it's all just in the morning because they don't check it at bedtime. But if you check it at bedtime, you can see which one's the highest. We always have people do that to see if giving basal insulin is going to help, because it may not. Because if your sugar is really high after a meal, then you need bolus insulin, like quick-acting insulin, to keep it from going up. So you always want to treat the first high sugar, and then the domino effect helps. You might need to be on pills later or other medications, to help the rest of the day. But getting that high one down is the first priority with adding insulin for type 2s.
Okay. And again, with the injectables, do you have more control over that, you say, or
yes, the
self-control?
insulin. Well, the insulin's getting shorter and shorter acting, so it works quicker at meals. And then the basal insulin is getting better as far as lasting all through the day. Lantus is the typical one that seems to last almost all day. Sometimes it doesn't last all day and you have to give it as 2 injections, but most of the time you can get by with 1 injection, especially in type 2. There's some new insulins coming out. There's one that lasts longer than a day. And there's also some new short-acting insulins that come out that work immediately, like as soon as you take it, it works. So that helps a lot because most people have trouble with the sugar going high after meals, even with the short-acting insulin, because it takes a while to absorb because you're injecting it in under your skin, so in the fat under your skin, and it takes a little while to absorb. So that's the insulin part.
Now but there are a lot of different ways. I mean, the means that you take it. These pens that are out, or
there's pens. Pens are very accurate as far as the dose. So just dial in the number of the units you want to take. Syringes are a little bit hard to see. The insulin goes in quicker with a syringe. So if you have a huge dose, you may want to draw it up in a syringe. But if you have smaller doses, especially at meals where you have to carry it around with you, it's easier to carry a pen than a vial and a syringe. So I think the tendency is to go with pens rather than injections, rather than syringes.
And once people are trained, they pretty much get over that whole idea of taking shots, right?
Some people don't.
Not really?
Some people just can't stand to take a shot, and I can understand that. But you need it. You know, we're not giving you shots because you don't need it. Now, it's not only insulin that's given in shots anymore. So that's another thing that people with type 2 need to realize, that they may end up with a shot that's not insulin. So when they come in their office and say, I don't want shots, you know, you go, well, what if the shot made you lose weight? Would you want that shot?
And then, yes.
Yes, and they like that idea. Like, oh, give me that shot. Give me that shot.
All right. We have more to come in a moment with Dr. K. Jean Lucas from Diabetes and Endocrinology Consultants. Again, you can find them online at beachdoctor.com for more information at beachdoctor.com. And Dr. Lucas, right before the break, you talked about sometimes people will have injectables or shots that are not insulin. So what are they?
Yes, it's a whole new group of medications that came out in 2005 with Byetta. Byetta was it's a hormone that makes the insulin be released at the right time. So it affects the pancreas, makes the pancreas work at the right time. Sometimes the pancreas is a little lazy, waits till the sugar goes up, and then releases insulin. This is the signal that tells the pancreas to make insulin at the right time. So it keeps your sugar from going up as high at meals. So Byetta started off with short-acting, twice a day. They're called GLP-1 agonists, which means they act like GLP-1, which is a signal that tells the pancreas to release insulin even when you're looking at food. So you already got the insulin going, your sugar never goes up. And so that's what they help with. They help, of course, if you still make insulin. So once you quit making insulin, they're not as helpful, except they do make you not hungry. So this is a medicine that helps your pancreas make insulin at the right time and makes you not hungry. So it helps with weight loss, which is always what we're looking for with new diabetes drugs. So the ones that are available are Byetta. Then Byetta got made into a weekly shot, which is Bydureon. Victoza was the second one to come out in 2009, and it's once a day. And you can titrate up the dose. You can gradually increase the dose so it doesn't bother your stomach or make you nauseated, because that's a typical side effect, is nausea. So if you go up too high on the dose, sometimes you feel that way. And then after that, there have been more weekly shots. So there's 2 weekly shots after Bydureon. That's Tanzium and Trulicity. And those are same thing. You just do it once a week. The once a week shots have a little teeny bit bigger needle, but they're still a short needle. Once a week is really good to just do it once a week instead of every day or twice a day. So I think the trend is for them to get longer and longer acting. And so the more they do research on it, the more they can find one that lasts a long time.
Yeah, now, do some of those need to be refrigerated?
Yes, when you're using the pens, they're in pens. So when you're using that pen, if you want to keep it out at room temperature, that's okay. But the pens you're not using, keep in the refrigerator so they don't deteriorate as fast. Because once they're opened and starting to be used, they usually last about a month, and that's all. So most of the time you're using that pen up in a month anyway, especially the Byetta pen, which is meant for a month. Victoza, depending on the dose you're on, you'll probably use it up in less than a month, maybe even 10 days. So each pen would only last for 10 days if you're on the maximum dose.
So if you have one that's a weekly dose, should you keep it in the refrigerator between times?
Yes. You should always keep it in the refrigerator unless you're ready to use it. Some people take it out, warm it up, not warm it up like in an oven. They
leave
put
it
it out
out.
room temperature so it won't be so cold going in. Because one problem with pain and injection sites is either that people are using alcohol, which burns as it gets injected under your skin, or they have cold insulin or cold
Right.
other shots.
Okay. All right. If you want to find out more, go online at beachdoctor.com. Again, for diabetes and endocrinology consultants, go to beachdoctor.com.